Welcome back. In your morning medical news, sick patients are at risk of being infected with misinformation when scrolling on social media. Research published in the American Cancer Society shows how cancer misinformation often has more reach than medical facts. Dr. Stacy Loeb, who's been studying the rise of cancer misinformation online, says her research shows up to 40% of cancer-related content on social media contains misinformation.
There's, several different types. There's outdated facts. Then there's also stuff about symptoms. There's posts saying, oh, if you have erectile dysfunction or bone pain, these could be early warning signs of prostate cancer. Like, no, prostate cancer doesn't have any early warning signs, actually. That's why screening is so important.
For reliable health information, consult your doctor and trusted sources like the American Cancer Society. The U.S. Department of Health and Human Services says it will require all new vaccines be tested in placebo-controlled trials before they're licensed for use. That policy change could raise questions about clearing for use updated COVID-19 boosters. Those vaccines get updated every year to better target the circulating strains of the virus. Experts warn requiring placebo-controlled trials before clearing new versions could delay availability. More and more young people are tearing their ACLs. An innovative procedure has now been approved for use on the youngest patients. Dr. Malika Marshall explains why this could become the surgery of choice for student athletes.
At 16, during a Final Four football game, Johnny Sullivan went in for a tackle.
My knee kind of bent and I just felt the pop.
That pop came from the anterior cruciate ligament in his knee. The star athlete had torn his ACL. To repair an ACL, surgeons typically borrow tissue from another part of the body, like a hamstring or a quadriceps tendon, to reconstruct the ligament.
Traditional ACL reconstructions can be quite painful. They have a relatively high failure rate, and student athletes can't always return to the same level of performance.
The bridge-enhanced ACL restoration, or BARE procedure, has become a more attractive option for some. The ligament is repaired, and then this collagen implant that looks like a marshmallow, bathed in the patient's own blood, is inserted into the knee to help the ligament heal.
We get this blood clot, then we get the body that creates the healing response, and then you get a healed ACL, which is really amazing because now we're keeping your own nerves, your own blood vessels.
Massachusetts-based orthopedic surgeon Dr. Scott Sigmund has performed more BARE procedures than almost anyone in the world. The surgery was FDA approved in 2020 for people 14 and older, but now it's available to school-age kids as young as 7 and 8 who are increasingly injuring their ACLs.
We have these really cool new anchors that are not made out of metal, so literally we don't have to touch the growth plates. In the past, if you injured a growth plate, the leg could actually grow wrong.
15 months post-BARE, Johnny says his knee is not only restored to the way it was, it may even be better.
So would you say that you're back to being one of the top players on your basketball and football teams?
Yeah, I would say so, yeah.
And back to dreaming about playing at the college level.
The hope is to one day use the BARE technique for other orthopedic injuries like rotator cuff tears or Achilles tendon ruptures.